President Obama used fake promises like "you can keep your doctor" to get Obamacare passed. Today, proponents are using fake numbers to try and keep it from being repealed. The administration claims 20 million more Americans today have health care due to Obamacare. But the actual numbers, the real numbers, show a different story. Heritage Foundation experts looked at the net gain, meaning how many people actually signed up for insurance, not just how many people in a survey suggested they would sign up, and found that the real increase is about 14 million people, not the 20 million number you've heard proponents of the law suggest. It's the difference, for example, in how many people actually cast a ballot in an election versus how many people said in a poll the week before they would go to the polls. But back to the real number of 14 million who now have health insurance due to Obamacare. Only 2.3 million are people who signed up for private insurance. 11.8 million, or 84% of the newly insured, were people given Medicaid cards, which is not the same thing as being signed up for quality health care. In fact, it doesn't ensure all those new recipients have health care at all. That's because increasing numbers of doctors and health care providers aren't accepting Medicaid. Additionally, a University of Virginia study found that for 8 different surgical procedures, Medicaid patients are more likely to die than privately insured or even uninsured patients. They were also more likely to suffer complications. Another underreported fact, yet very real number, is how many truly needy and disabled Americans are now not getting the services they need because of the expansion of Medicaid to healthy adults between the ages of 19 to 54. Over 500,000 disabled people suffering from developmental disabilities and traumatic brain injuries are on waiting lists for care. And many of them are on waiting lists because Obamacare gives states more money to enroll new able-bodied adults than it does to take care of the disabled who qualified for Medicaid prior to Obamacare. Finally, according to 2 new studies released by the Congressional Budget Office and another by the chief architect of Obamacare, MIT's Jonathan Gruber, it's estimated that anywhere from 2 to 7 million people now on Medicaid would have qualified for the program even if Obamacare never existed. Washington and politicians are known for stretching the truth. But the numbers don't lie, and Obamacare's 20 million number is fake.